Start. Welcome back guys. Now in this video let's discuss about the basal ganglia. Okay, very important for your exam, either it's FMG or NEET PG exam, very important. So what exactly is this basal ganglia? First of all, let me tell you what are the functions of the basal ganglia, what this basal ganglia is doing in your body. There are actually two important functions. Okay, two important functions are there. What are the two functions of the basal ganglia? See, basal ganglia is going to stores motor programs. Okay, it's going to store the motor programs. What does I mean by storing the motor programs? And it helps in the execution of the motor programs. See, for example, okay, at 5 years of age, do you know how to ride a bicycle? At 5 years of age? No, you don't know. But you learnt it and now you know how to ride a bicycle, how to balance a bicycle, how to do the pedaling. Okay. So, how to perform a motor action, okay, to fight with someone, to dance, okay, to go and catch something, okay, somersaulting. See, all these motor programs, where to flex, where to extend, how to perform a movement. See, these motor programs are stored in basal ganglia. So, basal ganglia is going to tell the upper motor neurons, okay, first of all, for example, when you are having a thought, okay, when you are having a thought, that thought will be going to the basal ganglia. So, basal ganglia will tell to the cortex, okay, to the upper motor neurons, which upper motor neuron should be activated, which upper motor neuron should be inhibited. So, upper motor neurons will control the lower motor neurons. Lower motor neurons are going to control the muscle contraction. So, it's a basal ganglia which is going to store the motor programs, how to perform an action, how to execute a motor movement. Okay, that's the one function. Second function is basal ganglia, it inhibits. It's going to inhibit involuntary movements. Basal ganglia inhibits involuntary movements. Okay, we are not having any unnecessary involuntary movements. The involuntary movements are totally suppressed. Okay, even though we are having the total connections, upper motor neurons, lower motor neurons, the muscles are, everything is ready, but unnecessarily we don't have any muscle contraction. So, basal ganglia is going to inhibit unnecessary contractions in our body. Okay, now you will be having it out, sir, where exactly is this basal ganglia located? Where exactly it is located? See, basal ganglia is not a one single structure. It is made up of multiple nuclei in our brain. Okay, multiple deep nuclei in our brain. So, what are the structures included in the basal ganglia? Okay, so basal ganglia, the components, okay, 5 important components are there. That is caudate nucleus, putamen nucleus. Putamen is also it's a nucleus. Okay, globus pallidus. In globus pallidus, there is something called as a globus pallidus internus, globus pallidus externus. Parts are there. Substantia nigra, which is present in the midbrain, which releases dopamine as a neurotransmitter, and subthalamic nucleus. Now, in your exam, what they will ask you is, see, caudate plus putamen, these two structures together, it is called as striatum. This is the MCQ. Okay, so caudate nucleus plus putamen is called as a striatum, and this striatum, it is going to release which neurotransmitter? GABA. It is releasing GABA as a neurotransmitter. Next, globus pallidus. Especially globus pallidus internus, very important part. Okay, it is going to release again GABA as the neurotransmitter, and always remember GABA is the inhibitory neurotransmitter. It's going to inhibit the things, inhibit the neurons. Next, substantia nigra. Okay, in substantia nigra again there are parts: substantia nigra, pars compacta, substantia nigra reticularis. Different two types of parts are there. But remember, substantia nigra is going to release dopamine as a neurotransmitter. Very important MCQ. And what about the subthalamic nucleus? What it will release? Which neurotransmitter? Subthalamic nucleus releases glutamate. Okay, glutamate. And regarding glutamate, the most important MCQ here is glutamate is the most excitatory neurotransmitter in the brain. Most important excitatory neurotransmitter. It's the most excitatory neurotransmitter in the brain. It's the glutamate. Answer is the glutamate. Inhibitory neurotransmitter is the GABA and glycine also. GABA and glycine are the inhibitory neurotransmitters, and glutamate is the excitatory neurotransmitter. Okay, sir, fine. Now, so the same topic of basal ganglia are the basal nuclei. Okay, the recent name is the basal nuclei. Basal ganglia is the old term. See, this basal ganglia topic, it will again come in your neuroanatomy also. See, in physiology, I am going to mainly talk about I am not going to talk about the connections. Okay, here I will be talking mainly about the functions. See, in basal ganglia, there are two types of pathways present. That is the direct pathway and indirect pathway. Two types of pathways are present. Look at here. See, in between different structures of basal ganglia, in between the different structures of the basal ganglia, See, there are some connections. Okay, these connections are called as either direct pathway or they are also called as indirect pathway. Direct pathway and indirect pathway. So, what is the function of this direct pathway and indirect pathway? Look carefully here. See, in direct pathway, okay, let's say here is a step 1. Okay, so in direct pathway, what is happening? See, we are not concerned about all these intermediate steps. I am talking final. What this thalamus is doing? Look carefully. See, thalamus, it is going to activate. The positive symbol means activation. So finally, this thalamus is activating the motor cortex. So the motor cortex is getting activated, the upper motor neurons are getting activated. Now the upper motor neurons will regulate the activity of the lower motor neurons, and the lower motor neurons are going to cause the muscle contraction. Okay. So direct pathway is always for the facilitation of the motor movements. Okay. Direct pathway is like an accelerator for the movements. Direct pathway always facilitates. The word is very important. Facilitates the motor movements. Okay. And what about the indirect pathway? Look carefully here. See, in indirect pathway, look at the final step. The thalamus, it is inhibiting the motor cortex. The motor cortex is getting inhibited. Okay. So what is the direct and indirect pathway? They are direct and indirect pathway. They are just like accelerator and brake. Okay. One is the accelerator for the movement. Other is going to break the movement or inhibit the movements. Okay. So now, right, what are the functions of the basal ganglia? See, I have told you there are two pathways, direct pathway and indirect pathway. Direct pathway always facilitates motor movements, stimulates the motor movements. Indirect pathway inhibits the motor movements, it stops the motor movements. Okay. Now, let me add a few more important details. See, dopamine, I have told you, dopamine which is coming from the substantia nigra pars compacta. Okay, mainly dopamine is coming from where? Substantia nigra pars compacta region. Now, this dopamine, what it will do? Dopamine is going to act, okay, where with the help of D1 receptors. Look, when dopamine is acting on D1 receptor, it is going to activate the direct pathway. It is going to activate the direct pathway. And you tell me, when the direct pathway is activated, what will happen? When the direct pathway is activated, it facilitates the movement. Dopamine facilitates the movement. Dopamine activates the direct pathway with the help of which receptors? D1 receptors. But the same dopamine, see, same dopamine by acting on D2 receptors. Okay, it's also acting on D2 receptors in different places of basal ganglia. When it is acting on D2 receptors, it is going to inhibit indirect pathway. So indirect pathway can be inhibited. Okay. So now you tell me, when the indirect pathway is inhibited, see, indirect pathway is like a brake. Indirect pathway itself is a brake. Now that brake is inhibited. Now the brake is gone. Now when the brake is gone, again that is going to facilitate the movement. So tell me, what is the role of dopamine? Dopamine always helps in the movement. Okay. It activates the direct pathway, inhibits the indirect pathway. Okay. So that is the reason why I have written here, dopamine always facilitates the motor movements. Okay. Now, loss of dopamine. Today, imagine that such an important dopamine, if it is lost, the dopaminergic neurons from the substantia nigra is damaged, pars compacta, it's gone. So that is going to cause a disease called as Parkinson's. Okay. Okay. So now tell me, what exactly is Parkinson's? We all know Parkinson's is a disorder where disease where there is movement problem. Okay, the patient is going to have akinesia or bradykinesia, cannot able to move properly, and you know the reason why. As the dopamine is not there, see, whatever might be the reason, if the dopamine is not there, the person cannot able to have the direct pathway activation. Without direct pathway, he cannot have the movements. So that is the reason why in a patient with the Parkinsonism, we say a triad of symptoms like rat symptoms are going to be seen. Rat stands for rigidity. Akinesia means no movement, he cannot able to move properly, or there may be bradykinesia, and there is going to be resting tremors, always the tremors, even during resting state he is going to have the tremors. Okay, direct pathway problem. Okay, so this is very important thing which I want you to know. The loss of dopamine is going to cause which disease? Parkinson's. Parkinson's is a problem with the basal ganglia. Okay, now look carefully here, lesions in the basal ganglia. Okay, lesions in the basal ganglia. What happens if there is a lesion in the basal ganglia? See, there are different structures of basal ganglia. Damage to different structures is going to cause different types of problems. I have told you, basal ganglia is predominantly, okay, it's inhibitory, it's going to inhibit the involuntary movements, it inhibits the unnecessary movements in the body. So today, maybe because of some stroke, let's say, basal ganglia is damaged. Today there is no more basal ganglia. So whenever basal ganglia is not there, do you think anyone there to inhibit the involuntary movements? Do you think anyone is there to inhibit the involuntary movements? No. So, no one is there to inhibit the involuntary movements, so the person is going to get the involuntary movements. So, damage to the structures of the basal ganglia is going to cause the involuntary movements. Okay. Now, let's see what are those involuntary movements. For example, if the striatum is damaged, Okay, striatum. We know what exactly is striatum, caudate nucleus plus putamen. So whenever this caudate nucleus is damaged or the striatum is damaged, it's going to cause a type of involuntary movement called as a chorea. Chorea is a type of involuntary movement. Okay, damage to the caudate, C for C. Caudate nucleus damage is going to cause the chorea. Now they will ask in your exam, chorea is what kind of involuntary movement? What type of involuntary movement? It is, okay, flicking. The word is important. Flicking movements. Okay, flicking movements of hands, face and other parts of the body. Okay, the word is important, flicking movements. Next, damage to the structure called as the globus pallidus. If this globus pallidus, if it is damaged, it is going to cause a type of involuntary movement called as the athetosis. Athetosis is due to globus pallidus damage. And what type of movement is athetosis? It's a writhing movement, dance-like movement, writhing. Okay, not writing, writhing. So writhing, dance-like movements of the hands. Okay, and neck and face. Okay, that's a athetosis, writhing, dance-like movements. Okay. Next, damage to subthalamic nucleus. This is very, very important for your exam. Subthalamic nucleus damage is going to cause a very violent movements in the body that is called as a hemiballismus. Okay, hemi means half. Okay, sudden jerky, okay, flinging movements, okay, sudden railing or flinging movements of the entire limb. So they are called as a hemiballismus. And you already know what exactly happens whenever the substantia nigra is damaged. That is going to cause a Parkinsonism, where the patient is going to have a rat, R-A-T. Rat symptoms will be seen. Okay, so these are the lesions. Whenever there is damage to the basal ganglia, that's going to cause different types of involuntary movements. Now, having said that, see, I have explained you the basics. Now, I will show you some questions. Let's say 10 important MCQs. In the MCQs, okay, you already know, some MCQs already know, and certain MCQs you will learn now. Okay, see, for example, let's start from here. Which of the following is not a part of basal ganglia? Which of the following structure is not a part of the basal ganglia? See, I have told you, basal ganglia, it includes caudate nucleus, putamen, globus pallidus. Thalamus is not a part. Subthalamic nucleus is a part. Okay, so thalamus is not a part of the basal ganglia. It's not a part of basal ganglia. Only 5 components are there. I have told you. Okay. Next, the striatum. I have told you the striatum is composed of which of the following structure? Striatum means it is caudate plus putamen. Okay, caudate. See, caudate nucleus plus putamen. So caudate nucleus plus putamen. Next, which neurotransmitter is primarily involved? Okay, which neurotransmitter is primarily involved in the modulation of the basal ganglia circuits? Okay, I have told you, for the activation of the direct pathway or for the inhibition of the indirect pathway, the most important neurotransmitter that is responsible is the dopamine via D1 and D2 receptors. So dopamine is the answer. Okay, that's the most important neurotransmitter. I have told you the Parkinson's disease is due to the degeneration of what? Parkinson's disease is due to the degeneration of the dopaminergic neurons in the substantia nigra pars compacta. Okay, next, hemiballismus is caused by lesion in which part of the basal ganglia? I have told you hemiballismus is due to the damage to subthalamic nucleus, which is going to cause what kind of movement? Hyperkinetic movements, that is sudden flinging or railing movements of the entire limb. Okay. Next, which of the following pathways facilitate the movement in basal ganglia circuit? Which pathway facilitates the movements? Facilitation of the movement means direct pathway. Okay, the answer is direct pathway. Next, which of the following basal ganglia components is primarily inhibitory and uses GABA as its neurotransmitter? See, primarily inhibitory, I have told you, know. Say the indirect pathway is inhibitory. Okay, indirect pathway is inhibitory. Okay, so what is the primary neurotransmitter? See, the primary neurotransmitter, see the GABA, where is it coming? See, it's coming from, okay, substantia nigra pars reticulata, not compacta. Okay, pars compacta, it's dopamine. Pars reticulata I am talking about. Okay, substantia nigra pars reticulata, it is going to release the GABA, and GABA is inhibitory. Okay, so again see, the substantia nigra pars reticulata along with the globus pallidus internus. What it will do? It sends GABAergic output. Okay, means inhibitory output to the thalamus. So whenever the thalamus is inhibited, cortex will be inhibited. So no movement. Okay, so let me show you the same in our diagram also. Look at here, my dear students. Okay, see. Here globus, see substantia nigra. Okay, see here substantia nigra. What I am telling you, substantia nigra. Which part? Substantia nigra pars reticulata along with the globus pallidus internus. What they are trying to do? They are trying to inhibit. They are trying to inhibit the thalamus. Whenever the thalamus is inhibited, okay, whenever the thalamus is inhibited, automatically motor cortex will be inhibited. Look at the direct pathway, indirect pathway, what is happening? See, when the thalamus is activated, it's the thalamus which will come and activate the motor cortex. When the thalamus is activated, motor cortex will be activated. When the thalamus is inhibited, motor cortex will be inhibited. That is which I want you to. So, what is the inhibitory signal? The main inhibitory signal is globus pallidus pars reticulata along with globus pallidus internus. Okay. Next, look at the 7th question. The substantia, here, Huntington disease. You heard about Huntington disease, autosomal dominant disorder. So, Huntington disease is associated with the degeneration of which part of the basal ganglia? Huntington disease is also due to the damage to the basal ganglia. Which structure? The answer is caudate nucleus. Damage to caudate nucleus is going to cause chorea. That is the reason why we say Huntington's chorea. Okay, Huntington disease is due to damage to caudate nucleus. So, whenever the caudate nucleus is damaged, see, look at the Huntington disease involves the degeneration of the caudate nucleus and the putamen gone. So, they are not going to release the GABA. Now, whenever the GABA is not there, GABA is an inhibitory neurotransmitter. Whenever the inhibitory neurotransmitter is not there, there is going to be excitation of the movements. Okay, so there is going to be more movements. That's the reason why there is going to be chorea. Okay, next, which of the following is true regarding the indirect pathway of the basal ganglia? Indirect pathway, have I taught you? See, it inhibits the movement through the subthalamic nucleus. I have shown you. Okay, it's the subthalamic nucleus will be inhibited, and the subthalamic nucleus, whenever it is inhibited, the motor cortex is inhibited. Okay, so it inhibits the movement through the subthalamic nucleus. Okay, next, 2 more questions are there. Look at these 2 more questions. Okay, which receptor type is involved in the direct pathway stimulation? I have told you, for the stimulation of the direct pathway, for the activation of the direct pathway, which receptors are needed? D1 type of receptors are needed. Okay, next, the main output nuclei of the basal ganglia. Out of all the different nuclei, what is the main output nuclei? The output nuclei is globus pallidus interna and substantia nigra pars reticulata. I have told you, it is either the activation or inhibition. See, it's either the activation or inhibition of this globus pallidus interna and substantia nigra pars reticulata is going to decide the activity of the thalamus, and the thalamus will decide the result of the cortex. Okay, thalamus is going to determine either to activate the cortex or to inhibit the cortex. So, the final output nuclei, is always globus pallidus internus along with the substantia nigra pars reticulata. Okay, so with this, the important topics about the basal ganglia are completed. How the questions are going to come? They will ask you the components of the basal ganglia. Always they will ask you what are the components of the basal ganglia, and they will ask you about the direct pathway, indirect pathway, who activates, who inhibits, and regarding the dopamine coming from the substantia nigra pars compacta, and the 2 types of receptors involved, D1, D2 receptors, who facilitate the movement, who inhibit the movement, and damage to different structures of the basal ganglia is going to cause different types of involuntary movements. Especially caudate is very important. Caudate nucleus damage is going to cause the Huntington disease, where the person is going to have chorea. Damage to subthalamic nucleus is going to cause a sudden railing or flinging movements called as a hemiballismus. Okay, hope the video is helpful. Thank you.